Good morning, Emma. I'm handing over the night shift report to you.
Morning, Daniel. Any updates I should know?
Yeah, Mrs. Dawson in room 305 had a spike in blood pressure overnight, 150 over 95. The doctor was informed and we monitored her closely. It came down slightly after she rested.
Right. So she's stable now?
Yes, but she needs another reading in an hour. Also, Mr. Patel in 308 had mild chest discomfort early this morning. The on call doctor assessed him, and they're considering adjusting his medication.
Okay. I'll check on them first. Anything else?
Yes, make sure to keep an eye on Mrs. Blake in 310. She's a fall risk, so she needs help when getting up.
Got it. Thanks for the update.
Hi, I need your advice on a patient. Mrs. Grant has been experiencing severe acid reflux, and her current medication, omeprazole, doesn't seem to be helping.
Hmm. Has she tried increasing her dosage?
Yes, we've already tried that, but she's still struggling. I'm considering switching her to pantoprazole or another PPI.
That makes sense. Pantoprazole is often more effective for some patients. I'd also check if she's taking any other medications that might be interfering with her current treatment.
Good point. I'll review her chart and prescribe pantoprazole if needed. Thanks for coming, everyone. We need to address infection control procedures.
Are there specific areas we need improvement on?
Yes, the latest audit showed that hand hygiene compliance is below 80%, which is concerning. We need to ensure that all staff follow proper hand washing protocols.
Okay. Should we conduct extra training sessions?
Absolutely. Also, we're reinforcing PPE usage, especially in high risk areas. Anyone working in close contact with infectious patients must wear masks and gloves at all times.
Understood. We'll remind the team.
You're being discharged today. Let's go over your medication.
Great. Do I continue with all my current medications?
Mostly, but the doctor has prescribed an additional blood thinner. You'll take this for the next 6 weeks to reduce the risk of clotting.
Okay. Any side effects I should watch for?
Yeah, you might notice some bruising or increased bleeding. If you experience excessive bleeding or dizziness, call your doctor immediately.
Understood. Anything else?
Yeah, no alcohol while on this medication. Also, your follow-up appointment is in 2 weeks. We're bringing in a 65-year-old male suspected stroke. Symptoms started 45 minutes ago. Slurred speech, facial droop, and weakness in his right arm.
Okay. We'll get the stroke team ready. Is he on any anticoagulants?
No, but he does have a history of hypertension. His blood pressure is 170 over 100 at the moment.
Understood. We'll assess him for thrombolysis as soon as he arrives.
Sarah, I noticed you seemed a bit unsure while handling the wound dressing earlier.
Yes, I wasn't sure whether to use the moist or dry dressing for that type of wound.
Okay, that's understandable. For chronic wounds like ulcers, we typically use moist dressings to promote healing. Dry dressings are better for post-surgical wounds.
Okay, that makes sense. I'll review the wound care guidelines again.
Good. If you're ever unsure, don't hesitate to ask. It's important that we use the correct dressing to prevent complications.